Dr. Bock. How are you today? Thank
Hi.
you.
I'm fabulous, thank you. It's
Thank
nice to
you.
be here. I'm glad you're here with me.
Thank you for taking time out of your busy day.
Well, you can see how busy we are, yes.
Well, Mrs. Gutkowski's class came up with some questions that we wanted to learn about our community partner, which is you.
Okay.
The first question is, how many years do you need to go to school to be a dentist?
Almost as many fingers as you have.
Oh my goodness.
It's 4 years of college, 4 years of dental school, and that'll make you a dentist. And then in dentistry, if you would like to specialize, say in orthodontics like I did, it's another 2 or 3 years.
Oh.
That's more fingers.
Okay. And your next question, how do you like your job?
Well, I love it so much that I've been doing it for, 30 some odd years.
Wow.
I used to be a fireman. I liked that job too, and I was a teacher, and I liked that job. But I didn't stick with those for 30 years, so I must love this. It's a great job.
Excellent. Thank you. I'm glad you like what you do. About how many hours a day do you work?
I do about 8 hours, like a normal kind of a job, but I work 4 days a week. I don't do 5. And at the end of the day, sometimes I have paperwork and I'll sit around and do that. But 8 hours, that's enough. That gives me still a little energy to go home and do something else.
Excellent. Who is that little guy?
Well, he's a toothy grin. Remember we talked about that, the socks and everything? He shows people how important it is not to be an alligator necessarily, but to keep your teeth nice and clean, and that's what braces look like on your teeth.
Ah.
So we show people this, and he also has a squirt gun in here. I'll show you how that works.
Oh, no, that's okay. All right, we'll go back to the question.
Okay.
How many patients do you get to see in a day?
Well, probably nowadays, maybe 50 or 60. We can see a lot more than that, and some days are slower than that, but that's probably an average.
Wow, thank you.
It's not like dentistry, the procedures take a long time. In ortho, most of our procedures are probably 15, no, they're not 15, probably more like 25 or 30 minutes.
Okay. Oh. What brand of toothpaste do you use?
I wish I knew which the best one was so that I could tell you, so I use all of them. Whatever my wife, who stands over there right now watching me, whatever she brings home I use. If they taste good, I like them. And they do.
Next question. What dental school did you go to?
I went to University of California in San Francisco.
Huh.
And I was born up there, so it was kind of fun to go back home.
Oh, very nice. And how long have dentists even been around?
I think it's as long as toothaches. Now, they wouldn't be a dentist like today where you go to all this school. They'd be some guy with a couple of bones that will knock that tooth out for you. But organized dentistry goes, I think, back into the 1700s, probably. And it's been kind of interesting, the history of it.
And how long have you been in dentistry?
Since 1986. It's a long time.
And I bet you've seen a lot of innovation and changes, right?
No, that's one of the questions I'm sure you're going to ask me is, how has it changed? And the computers and the scanners and everything has evolved so much that the job I have right now, and the basics are the same. You know, you come in, you want your teeth moved, you want some kind of dental work, but the tools they have to address those things, it's wild, and it's just growing so fast. If anybody wants to be a dentist nowadays, at the kids' age, when they get out, I wouldn't even recognize the kind of environment.
A lot of technology, huh?
It's going to be wild.
Yeah.
Wild, really fun.
Exciting times. So, what other jobs do you have in your office?
Well, we have, when you walk through the door, the first person you'll see sits behind those computers on the front desk, and she's our receptionist.
Okay.
Next to her will be the office manager, who basically manages everything, because we do have these 8 or 10 people, and everybody's doing different jobs all the time. So it's kind of like a bunch of mice running around in a maze, and somebody has to keep track of it, and I can't do that. So we have an office manager, and she's also the treatment coordinator, and the treatment coordinator is the one who sits next to me when you come in for a consultation, and she translates all my jibber jabber into terms that are understood by everybody. And then I get out of there, she breathes a sigh of relief, and then she explains what I said in terms that are probably a lot better than the ones I use. Then there's my wife, and she's actually a partner, and she does all the things. Like today she was crawling around on the floor, which is a great place for her, because she had to fix the computer. So she's always on the phone. She's involved in, you know, how we pay our bills and all of that sort of thing. Then we have a bookkeeper who does all of the financial stuff. So every time you make a payment, it goes into a computer, which winds up in your balance. And there's all of these different things and categories that have to be accounted for at the end of the day, and that's her job. Now, if you leave her, you'll probably bump into my granddaughter, who does all our sterilization. A few steps back, we have our lab technician, where all of the x-rays are taken, all of the computer stuff having to do with entering data points and things like that happens in that little chart, in that little room. And then once you get your x-ray in there, if you happen to be one of our patients, you walk out on the floor, and we have 3 assistants on the floor doing all of they help me deliver the treatment. Every patient gets to see me and has to listen to me, and then they get to deal with the assistants, who are much nicer than I am. And then when you're all done, you walk out, see the front desk for your next appointment, and then see you later till next month.
Excellent, thank you. Last question, what is the hardest part of your job?
The hardest part? For me, it's probably the business part. All of that business stuff, I leave so much to my staff that for me, if they ask me a question about how to handle all of that stuff, so that's hard for me. What's easy for me is being in the back and doing all that stuff.
A question I have, and maybe some other students have, is what's the difference between a dentist and an orthodontist?
Okay, a dentist, every orthodontist is a dentist, but not every dentist is an orthodontist. So then what that means is, when you get to the end of dental school, you've done your 4 years. Some of us, at the end of the 4 years, have decided that we prefer we want to specialize in just one aspect of dentistry. We haven't had one. There's the oral surgery, endodontics, periodontics, that deals with gum issues. There's prosthodontists, they do lots of more than the usual number of crowns and bridges and implants and all that kind of stuff. So what an orthodontist does is straighten teeth. But we concentrate on just the movement of teeth, making the smile shine. That's what we do. It's just fun. It's a kind of dentistry that I feel good about, and it's fun. And so that's why I chose it. So we are the people that put braces on, or Invisalign, or braces on the back of your teeth. Those are the things that we do, is seeing a nice smile at the end of the day.
Thank you so much, Dr. Bock, and I look forward to going on a tour.
Well, that comes up next.